Dr. Paul Johnson, Interventional Spine and Pain Management Physician at Advanced Pain Medical Group, talking today about PRP. PRP is an acronym for platelet-rich plasma. This is a relatively new treatment modality or therapy that's aimed at promoting healing, improving pain, and recovery of function from injury. Patients who could benefit from PRP therapy include patients that have suffered an injury, usually a soft tissue injury of the knee, shoulder, hip, ankle, or other part of the musculoskeletal system. There's some benefit for patients with degenerative conditions of the musculoskeletal system, such as osteoarthritis in the knees, hips, ankles, wrist, even the jaw. It's been used extensively in periodontal work to promote healing. So patients traditionally suffer injuries in daily life, and it doesn't have to be associated with a sports-related activity, and that's a lot of the focus of PRP initially, and how it's come to be more in the mainstream was use on elite athletes after injury to a joint. For example, a ACL tear suffered during a football game in a professional football player that needed to be surgically reconstructed, and the PRP was included in the surgical reconstruction to promote healing, improve the functionality sooner, and to get the athlete back to a condition where they could compete. Now, not all of us are elite athletes, but we do suffer the same conditions and injuries that elite athletes can suffer. We can tear an ACL, we can injure a meniscus in our knee, we can have some damage to the rotator cuff in our shoulder or the labrum, and all these conditions show promise with treatment with PRP to improve functionality, restore health, and to decrease pain, and thereby speed the recovery process. PRP is an injection-based therapy. So we extract the patient's blood and centrifuge it, often referred to as spinning it down, to remove the cellular components of the red blood cells and the white blood cells from the liquid component of the blood. The liquid component of the blood is the plasma. We keep the platelets in the plasma because the platelets have a high involvement in healing. Platelets release growth factors that are essential to the repair of tissues. So when there's an injury, a trauma, the platelets are integrally involved in repairing that tissue, and we want to concentrate those substances that the platelets release into an area of injury, such as the shoulder or the knee, after there's been some type of trauma. So what happens is a patient comes to the office for consultation, is evaluated by one of the physicians at Advanced Pain Medical Group, and if the treatment of PRP is appropriate and recommended, the patient will be scheduled for a follow-up for the procedure. The procedure is done in an ambulatory surgical center where sterility and the quality of the procedure can be to the highest degree. There is minimal pain with the PRP procedure. Oftentimes there are concerns over the injection and how much pain is involved with that. It is minimal. The patient will come to the ambulatory surgery center, check in, the nursing staff will prepare the patient. There will be blood extracted from the vein, about 10 milliliters, which is a small amount of blood, and that is centrifuged down. The plasma is then sterilely taken, placed into a syringe, and injected into the injured part of the patient's body. After that, the patient is taken to the recovery area where they remain for a short period of time to make sure there are no complications to the procedure, and then the patient is discharged home. Normal function can resume the next day. There are no prohibitions the following day. We like the patient to remain relatively inactive the day of the procedure because it is an interventional procedure, an injection therapy. The staff will contact the patient the next day to make sure there are no problems. The physicians who perform the procedure are always available through telephone or through the paging service, and the patient is then scheduled for a follow-up visit with the physician a week to two after the process. Platelet-rich plasma therapy, or PRP, is being used more and more commonly to treat a number of ailments and has a lot of promise in improving functionality, restoring lost function, decreasing pain, and returning a patient to a quality of life they were used to prior to the injury quicker than if the treatment modality of PRP was not used. The physicians at Advanced Pain Medical Group are very versed and skilled in the administration and the diagnosis that leads to the administration of the PRP therapy. The most important focus at APMG for the staff and the physicians is the patient. So determining the right treatment, whether it's PRP or something else, is what we're skilled and very good at, so we can bring the patient back to their quality of life.